Hello, everyone, and thank you so much for joining me today on this what I think, very interesting topic, the mysteries of the thyroid. I'm sure a lot of you are thinking the same things, that the thyroid gland is very mysterious, and there's probably lots of questions you have surrounding it. So, the purpose of today's webinar is one, to understand a little bit more about the thyroid and what it does, and two, just kind of understand some of those mysteries and uh, why we feel the way we do and why our labs may be misleading as well. So let's get started here. Just to start by introducing myself, I'm Dr. Hirani. I'm the medical director at Rose Wellness Center, and I've been practicing functional medicine for about 20 years now. Really, really enjoy what I do. I started by doing my residency and board certification in family practice in Michigan. After that, I realized there was a lot of things I couldn't practice within the traditional boundaries of traditional medicine. That's when I started exploring more alternative forms, and here I am today. So, my approach is I try to combine the best of both worlds. I use traditional medicine when absolutely necessary. My preference is to work with natural or functional medicine, where we really try to look for the root cause, see what's going on in the body, and bring the body under better balance. Okay, so let's get started here. And by the way, this webinar will be recorded. You all will be getting the recording. And if you have any questions, please feel free to type them in the chat box as we go along here. I will spare some time at the end to answer all of your questions. All right, so the thyroid gland. This is a small walnut-sized gland located right in the center of our neck. Looks like a little butterfly. However, it really controls the energy production and functional regulation of every single cell in our body. It tells every organ system what to do. I kind of call it the motor of our cells, telling everybody to do their job. It says brain cell, do your job, heart cell, do your job, bone cell, do your job, from head to toe. Okay. So, hi, I'm your thyroid gland. I am small, but I control your life. So, because the thyroid tells everyone to do their job in the body, hypothyroidism, when you have too little thyroid hormone, think of everything as slowing down. So, none of our cells are really performing their job appropriately. So, therefore, the symptoms of hypothyroidism are those of everything slowing down: fatigue, low mood, feeling very cold, gaining weight, losing hair, constipation, brain fog, even elevated cholesterol can be a symptom of hypothyroidism. So, that's why hypothyroidism is many times called the great masquerader, because it can mimic so many different medical conditions. So let's look at some statistics. First of all, hypothyroidism, which is mostly going to be the focus of our talk today, is a highly underdiagnosed condition. About 20 million Americans suffer from improper thyroid function. Did you know that levothyroxine, which is the main medicine used to treat hypothyroidism, tends to fall in the top 5 most prescribed medication list most years? In fact, in 2023, it was number 1. On top of that, about 60% of people with thyroid disease don't even know that they have thyroid disease. Women are much more higher likely than men to develop thyroid problems. And 80 to 90% of hypothyroidism in the United States is thought to be due to autoimmune or Hashimoto's. And we'll be talking more about this later on. It's estimated that 1/3 of hypothyroid patients have normal blood test results. And about 20% of people that are hospitalized for severe depression were actually found to have Hashimoto's disease. Little more than half of patients with untreatable major depression actually may have hypothyroidism. These are some huge statistics. And this kind of little cartoon to reflect that. How many of you feel like this? So, Dr. Richard Shames is the author of Thyroid Power. He said this wonderful quote, which I really, really believe in. He said, although extremely common, low thyroid is largely an unsuspected illness. Even when suspected, it is frequently undiagnosed. When it is diagnosed, it often goes untreated. When it is treated, it is seldom treated optimally. So, this is a real medical dilemma. Improper thyroid function, as I mentioned before, is often misdiagnosed as a variety of other conditions, and it is commonly treated as depression because of the large number of vague systemic symptoms that people have with this. So let's take a scenario, and many of you may relate with this. You're not feeling well, you're tired, gaining weight without reason, cold all the time, achy, constipated, brain foggy, so on and so forth. You think you have hypothyroidism, choose to get some blood tests done, and they're normal. Well, you didn't really expect that. I mean, you're clearly not feeling well. So, what is going on? You ask yourself, why do I still have thyroid symptoms when my lab tests are normal? Well, let's explore this a little bit. TSH is the main blood marker used to diagnose hypothyroidism. I'm pretty sure most of you are familiar with this test. Problem is, multiple authorities, including the NIH, National Institute of Health, have proven that TSH testing is not very reliable. Yet, that's the test we rely on to diagnose hypothyroidism. TSH, unfortunately, is affected by too many factors to be completely reliable. And this has been demonstrated by many different authorities and research studies, like I said, including the NIH in its 2018 study. And it's done more studies since then. So, this particular study took people who had hypothyroid symptoms and they checked their TSH using two different lab methods, something called immunoassay, which is the one that's typically used in labs today, and another testing method called mass spectrometry. The immunoassay, in a lot of these people that had the low thyroid symptoms, the immunoassay testing showed normal TSH, whereas the mass spectrometry showed an abnormal TSH. Those people with the low thyroid symptoms and abnormal TSH seen on that particular test were treated for their low thyroid and their symptoms improved. So the conclusion was that this mass spectrometry testing was much more accurate than the immunoassay. The problem is that this type of testing method is only available in research labs, and none of the major labs, including Quest and LabCorp, use that. The reason being, quote unquote, this testing is complex and unsuitable for high output laboratory analysis. In other words, it's not a very practical test that can be done for the general population. So that can be a real problem, as you can see. Additionally, thyroid function is too complex to just rely on a single test. In fact, TSH isn't even a thyroid hormone. It's made by the pituitary gland in our brain and acts on the thyroid gland, so the TSH only tells us a part of the story. To get the complete story, you really need to do much more comprehensive testing, which includes tests such as T4, T3, reverse T3, thyroid antibodies. All of these can be done on your regular blood test. The American Thyroid Association actually makes a statement saying the same thing, that you need further testing. So why is it that we rely only on TSH? The other problem with TSH is that the reference range of it is very wide. It can be anywhere from the normal can be anywhere from 0.3 to 5.0. Well, again, TSH values differ so much according to so many different factors, including age. Did you know that different states have different normal TSH ranges? For example, you could be in Texas and be diagnosed with hypothyroidism, but the same TSH value in the Virginia, you would be normal. Okay. Now, again, multiple data suggests that those reference limits of TSH are not a representative of a true normal range. And the normal range, true normal range, is probably more like 0.4 to 2.5. The National Academy of Clinical Biochemistry has suggested that this should be the normal range. And again, various other studies have shown this as well. So good news, your tests indicate you're in the normal range. So clinical symptoms as well as testing put together is very important to understand and diagnose as well as monitor hypothyroidism. You can't ignore one or the other. So to understand this a little bit better, let's understand how thyroid physiology works. I think it's very important to understand this. So as mentioned before, TSH stands for thyroid stimulating hormone. It's produced by the pituitary gland in the brain. What does it do? It stimulates the thyroid gland to produce thyroid hormone. Well, the bulk of the thyroid hormone produced by the gland is in the form of T4, as you can see there. Problem with T4, however, is that it's metabolically inactive. It doesn't really do too much. Our body depends on that T4 being converted to its active form, which is T3. T3 is the one that actually goes and delivers the energy supply to all the cells in our body. Think of that like, as if T4 is the ignition key to your car. So you're sitting there in your car, you have the key in your hand, but you're not going to really get anywhere until you turn that key on. That's what T3 is. It's as if you're turning on the cells in your body. Okay. Then we have something called reverse T3. This is also known as antithyroid. It actually clears out excess thyroid hormone from the body. If you have too much reverse T3, you're going to be clearing out much more thyroid hormone from your body than needs to be, even though you might be producing enough. So that's like somebody coming into your car, grabbing the key from your hand and running away. Now you're sitting in there in the car without your car key. Okay. So this is kind of the whole concept. You need to test TSH, T4, T3, reverse T3, and thyroid antibodies to really understand what is going on, because you can have a normal TSH, but an abnormal T4, or you can have a normal T4, but an abnormal T3, and the list goes on. Okay. The reason why that matters is, as you can see on this slide, there's many different factors that affect the thyroid physiology at these different levels. So for example, if you are not able to produce enough thyroid hormone, if your T4 is low, that means you're not producing enough. There's many different causes of that. We may want to really look at those causes in more detail. Or suppose your production is fine, your thyroid gland's actually working just fine. Problem is, you're not able to activate that into the T3. Again, as you can see on this chart, there are many different, especially selenium and zinc, that actually help us to convert T4 into T3, but many other things on the left side of that slide as well that can inhibit that conversion. Okay. And then there are other things that can also increase our production of reverse T3. Remember, that's the thyroid clearing hormone or the antithyroid. So once we understand where the abnormality is, we can start digging and looking into some of the root causes of those different steps. Overall, the most common cause of hypothyroidism worldwide is actually iodine deficiency. T4 stands for 4-iodine molecules. So as you can see, thyroid hormone is made from iodine. So if you're missing this raw material, which is so important, you're not going to even be able to make thyroid hormone. The most common cause of hypothyroidism in the United States is actually autoimmune or Hashimoto's, and we'll be talking about that in more detail. I'm not going to get into too much about these other causes, but you can see there are various other causes of hypothyroidism as well, as we also saw on the previous slide. Don't forget stress. Stress can play a huge role contributing to hypothyroidism. What does stress do? Stress affects other hormones in our body, like cortisol, for example, or DHEA. And as you can see on this somewhat busy slide here, cortisol can affect the thyroid physiology in many different places. It can prevent production of thyroid hormone. It can prevent conversion or activation from T4 to T3. And high cortisol can also produce too much of the bad reverse T3. Finally, there's something called thyroid hormone resistance, where maybe all your labs look normal. You have normal amounts of all of these, but it's really just not getting into your cells. And that's a little bit more of a presumed diagnosis based on various factors. Okay, so stress can affect the thyroid at various different levels. So Hashimoto's, this is the most common cause of hypothyroidism in the United States. This is an autoimmune condition in which the body, by mistake, attacks its own healthy thyroid tissue. Why does this happen? Well, for some reason, our immune system becomes overreactive. So I tell a lot of my patients, Hashimoto's is not originally a thyroid problem. It's originally an immune system problem. Okay. For some reason, our immune system goes haywire, attacks your thyroid, and then this eventually becomes a thyroid problem. When enough damage to the thyroid gland occurs, we start to see that TSH become abnormal, and then you're finally diagnosed with hypothyroidism. In fact, you can have thyroid antibodies for up to 10 years before your TSH is actually abnormal. And that's why, again, another reason why you need to test all of these things in your thyroid panel, not just the TSH. Okay. Understanding what's putting that immunity into overdrive is one of the biggest keys to treating and managing Hashimoto's. Many different factors can cause this, and there's a whole nother webinar and talk I do about autoimmune disease, and I get into a lot more detail on there. But generally speaking, chronic hidden infections, or even more obvious infections like H. pylori, Epstein-Barr virus, things like that, can cause our immune system to go into overdrive. Injuries, an overload of toxins, diet lacking in antioxidants, something called leaky gut or intestinal hyperpermeability causes gradual immune destruction. And then many times with people with Hashimoto's, they will have symptoms long before the actual diagnosis is made. Problem is, by that time, a large part of your thyroid gland is already destroyed and it's much harder to treat and get relief. With Hashimoto's or autoimmune, we typically see something called molecular mimicry. So the hypothyroidism or Hashimoto's is notorious for its molecular mimicry with gluten. What do I mean by that? So the thyroid hormone and the molecular composition of the thyroid hormone and tissue is very similar to the composition of gluten. As you can see over there on the right side, look at the gluten, look at the casein, and then look at thyroid tissue. So you can see how sometimes the immune system might get a little confused because the thyroid tissue and gluten look very similar to each other. So in those people that are eating gluten and your immune system attacking gluten, it's going to attack the thyroid tissue, thinking your thyroid is also. Okay, so this is a concept known as molecular mimicry. If you have Hashimoto's, it's well worthwhile determining if gluten intolerance is, one of the factors affecting your thyroid and Hashimoto's. So how do we diagnose hypothyroidism? There are various things we need to really look at. One is clinical evaluation. Questionnaire, history, these things are very important because you also have something the opposite, something called subclinical hypothyroidism, where maybe your lab tests look abnormal, but you don't have any symptoms. Well, the research clearly shows in that event you may not need to treat it. You might be okay. All right. So again, subjective and objective. You got to look at the symptoms, and usually in our clinic we do very precise, detailed hypothyroidism or just thyroid questionnaires. Laboratory tests, but again, complete testing. You can do body temperature charting, and then also testing adrenal function, or the medical term HPA axis dysfunction. Why? Because believe it or not, again, as we mentioned before, stress, high cortisol, adrenal dysfunction, these can also cause an elevated TSH. And in fact, people with adrenal dysfunction can have symptoms very similar to hypothyroidism. So maybe all your thyroid tests look normal and you actually don't have hypothyroid, but you have adrenal dysfunction instead. Okay. And then you really want to focus on treating that. So body temperature charting can be done as well. Not always helpful, but sometimes can be helpful, especially if we're trying to differentiate if your symptoms are due more to the thyroid or more to the adrenals, and some of those somewhat confusing, clinical pictures. You can see on the top graph over there, that's typical body temperature charting with hypothyroidism. So if you check your body temperature, sorry, the top graph is, hypothyroidism. So if you check your body temperature, first thing in the morning, at rest, when you first wake up, ideally an oral temperature. People with hypothyroidism tend to have a lower body temperature. And as depicted by that graph, every time they either start thyroid medication or increase their dose, you can see that temperature getting more and more into the normal range. Again, this is a reflection of poor metabolism. So it can be very helpful to track this and kind of just get an idea of how your thyroid is working for you. The bottom graph on the flip side shows temperature graphing for adrenal insufficiency. Now, people with adrenal insufficiency also tend to have low body temperature, but one of the main differences is that it's relatively like a stable low temperature in hypothyroid, whereas in adrenal, it goes up and down, but low. And then as you start the adrenal support, it's still up and down, but more towards the 98.6 range where it's supposed to be. Some tips for doing lab tests in the most accurate way possible. So this has been put out by Dr. Weston Childs, and I found this very interesting too. He used to be a functional medicine doctor and now really focuses and dedicates his time mostly to research. And he is an expert in the field of hypothyroidism and has done a lot of research regarding this particular field. So some of his tips to get the most accurate test results. One, of course, as we mentioned before, get the full thyroid lab panel. Two, try to get your labs drawn at 8 a.m. every time you get them done at the same time. That's when we have our peak thyroid levels. So it can be very helpful to understand what's going on. The way our TSH can fluctuate throughout the day. So if we're testing them at different times every lab test, we may not get an accurate understanding of our TSH over time. Three, check your thyroid lab test in a fasting state. So ideally, again, check it at 8 a.m. in the morning, then take your medication right after, and then eat 1 hour after that. Again, different types of foods can also affect your thyroid function, believe it or not. A thyroid's a very sensitive hormone and sensitive gland. So again, we want to see it at its most sort of accurate baseline without anything else affecting it. 4, check your labs before taking your thyroid medication. 5, avoid testing thyroid on days 10 to 20 of your menstrual cycle if you are a menstruating woman. Estrogen, progesterone also in the menstrual cycle tends to have different peaks and troughs. And believe it or not, those can also affect your TSH or your thyroid hormones. Avoid taking biotin prior to your lab test. Again, you should ideally do your lab test first thing in the morning before you take anything else. So then that shouldn't be a problem. But biotin can interfere with the testing method of TSH, and that includes a multivitamin with biotin in it. Now, sometimes I'll do lab tests in 4 weeks, but ideally, typically, you want to check no sooner than every 6 weeks. It does take time to see the finalized effect of the thyroid hormone regulation in your body. So again, when we do look at those tests, especially the TSH, we want to look at the optimal range, not just the normal range, ideally. Sometimes it can be very important. In fact, many times it can be very important to do other tests as well, especially if you have Hashimoto's, to really understand what else is contributing to hypothyroidism, as we talked about earlier. So it can be helpful to do male and female testing, adrenal hormone testing, vitamin and mineral deficiency evaluation, testing for drug, chemical, heavy metal toxicities, chronic underlying hidden infections, and food intolerances, especially gluten. Not everybody needs all those tests, by the way. That's why history, physical, detailed questionnaires, all of these are important so we have a better understanding of what you may need particularly. All right, now we figured out we have hypothyroidism. We figure out at what level the problem is going on. We're looking for root causes and underlying causes. How do we treat it? Okay. Number one, treat the underlying cause. All right. That is one of the most important thing, right? So if we understand what that cause is and if we figured it out, work on that. You've got H. pylori, you've got Epstein-Barr, you've got heavy metals, you've got a bunch of gut infections, you're, trouble with producing it, high stress and adrenal, whatever it may be. Always, always want to work on those underlying causes. Okay. However, if you do need thyroid hormone replacement, the most common one used are conventional synthetic thyroid hormones. That would be things like Synthroid, levothyroxine, Cytomel. Synthroid and levothyroxine are T4, and Cytomel is T3. Remember what I had said earlier. Unfortunately, most people only end up taking Synthroid, and that's fine for those people that convert to T3 well, because you'll take your T4, it'll convert to T3, and you'll feel great. But then there's a lot of people that said, okay, finally I've been diagnosed. Finally, I'm getting some Synthroid or levothyroxine here. I thought I would feel so much better. Why do I still not feel good? Well, remember, T4 is metabolically inactive. If you're struggling with conversion to T3, then you might also need to take T3. Okay. Because T3, again, is that turning that ignition key on, turning the motor on to every cell in your body. So taking adequate amounts and the appropriate type of thyroid medication is very important. You can also take natural thyroid preparations known as natural desiccated thyroid. The two available currently are Armour Thyroid and NP Thyroid. Armour Thyroid has been out for over 100 years. Okay, one of the oldest thyroid medication preparation. In fact, the only thing that was used before Synthroid came out about, 35, 40 years ago, or maybe a little more, 50 years ago. So the advantage to the natural preparations is they already have T4, T3, and believe it or not, a little bit of T2, T1 in them. It most resembles our own thyroid hormone, which is very helpful. But some people need the separated T4 and T3 because sometimes we need to get the exact amount. The problem with the natural desiccated is the T4 and T3 come in a fixed ratio. So if we want to increase one and reduce the other, we can't really do that with this, right? Because you either have to increase the whole thing or reduce the whole thing. So for some people where we really need that fine tuning, it's helpful to separate out and take T4 and T3 separately. We can do that through compounding pharmacies. We can do it through the regular traditional prescriptions as well. Okay. Synthroid does tend to have a lot of dyes in it. So if you have a lot of dye allergies and things like that, you want to be careful. The 50 microgram dosage, by the way, just as a little side note, has got the least amount of dye in it. All right, other things we want to do for the thyroid. Not everybody needs thyroid medication. Some people do, and that's fine. Not everyone needs it. We might be able to correct your vitamin mineral deficiencies like iodine, for example, or selenium, and then treat your thyroid. improving diet, nutritional status, correction of other hormonal imbalances, correction of leaky gut, and again, looking for all those root causes, as we mentioned before. Some dietary guidelines on here. I'm not going to go over all of these in detail. I'll let you read through this on your own. Again, you all will be getting a recording, but a couple things I want to point out on here. One is, remember, if you have Hashimoto's, it's very important to understand if gluten is a problem for you or not. You can either do that through certain types of, gluten testing. They're not always very accurate, but it can be. Or doing a gluten elimination diet. You do have to do it for a minimum of 2 months to really understand if gluten is affecting you or not. And ideally, test your antibodies before and after that trial of gluten avoidance. Okay. Please be careful of raw cruciferous vegetables. Now, cruciferous vegetables, don't get me wrong, they are wonderful for your body, for your system. They have anti-cancer properties, and they're so, so important. So just because you have hypothyroid, I don't want you to think you can't eat them. In fact, you should eat them. However, please try to eat them non-raw, okay? Cooked, steamed, baked, grilled, air fried, however you want, but not as much raw. You can eat raw, limit that and eat more of the non-raw forms, okay? Those would be things like broccoli, cauliflower, kale, Brussels sprouts, asparagus, things like that. The other thing I really want to mention over here is iodine. So as I mentioned earlier, iodine is a very important nutrient for the thyroid. And iodine-rich foods can be very, very helpful, along with selenium-rich foods. Selenium, especially if you've got the T4 to T3 conversion issues. And also, it is very important to make sure you're getting adequate protein and vegetables in each of your meals. Okay. Very important because you need protein to help produce thyroid hormone. Exercise, people with hypothyroidism, I know a lot of people with low thyroid have weight gain, right? You don't understand your weight's going up and you're doing all the right things, but your weight still keeps going up. Please keep in mind it's not you, it's your ability to lose weight that's the problem in that particular situation. Okay. So the big mistake that people make with hypothyroidism is they start to eat less and work out more. Believe it or not, by doing that, you could be worsening your hypothyroidism, messing up your metabolism, and it might be very difficult to correct that. So even though it sounds counterintuitive, please make sure you're eating your adequate quality, macronutrients and calories through the day that you should be eating, especially that protein. And exercises such as light cardio exercises and strength training, a combination of those can be the most helpful for people with hypothyroidism that especially want to try to lose weight and build muscle. Remember, the better your muscle health, the better your metabolism. So people that are going on these starvation diets and over exercising, you're really wasting away your muscle. Okay. So very important to keep that muscle healthy. Get enough sleep. I call sleep our battery charger. So again, if we're not sleeping, we're not charging our battery. We can't expect our body to work properly if we're not charging our battery. Okay. So don't put demands on your body and it can't give us the supply, right? We've got to make sure that we are taking care of our sleep. American Sleep Society says 7 to 9 hours for the average person is important at night. And if you're having sleep issues, you need to figure out why that is. So, general prevention, if you know you have a family history of hypothyroidism, if you know that you've got the thyroid antibodies and you're having symptoms, these are things you can already start to work on right away. Mostly, you're going to get help from a functional medicine doctor who really, really delve a lot deeper into all of these things. But I think everybody knows that you got to do some of the preventive health things that it says on this slide. You don't need a doctor to tell you that, right? So just take extra care of your health, especially if you know you're prone to these things. Nutritional supplements, again, you can read these. I'm not going to talk about all of this, but I do want to point out iodine. Please do not, if you have hypothyroidism, please do not just take iodine unless you're under the medical supervision and it's been recommended by your doctor, because iodine can be a double-edged sword. Although it can be a wonderful nutrient and help you tremendously, it can also be a poison. Okay. There has been some research studies that showed that iodine can actually worsen Hashimoto's, and I have seen that happen. Not in everybody, but it can in some people. So again, there's different factors to be looked at. Do you truly have iodine deficiency? Because that's when it's really going to help the most. Okay. So checking iodine levels can be very helpful as well. And then you can see some of the other nutrients on this slide, which can be helpful. Again, you can also do nutritional testing to see what you're lacking in. So there's lots of different methods. Again, number one, we have to diagnose the hypothyroidism through symptoms, through subjective, and then through the appropriate testing and perhaps other tests besides just the thyroid blood test, right? So the correct diagnosis is so important. Two, once we know that we have it, correct treatment is important. You want to look for the underlying cause. Now, I'm not saying this is easy. It may not be. There might be, you may have to go on a little bit of a journey here to really try to figure out what is your cause and what is contributing to this. And that's the thing with functional medicine. Sometimes, we do need to dig deeper. This is more of a marathon, not a sprint. But the beauty is when you do find that root cause and when you are able to correct something, it goes a long way, right? It really, really goes a long way. You're not just quote unquote chasing the TSH with thyroid medication. So, please, everybody, feel free to type any questions you have in the chat box, and I'll be happy to answer any questions you do have. I'll give you a couple minutes over here to type out any questions. There really is a lot you can do for hypothyroidism, and please don't despair um, and think that you have to live like this for the rest of your life. Again, you're typically seeing a functional medicine doctor is going they are usually a little bit more of the authority on how to treat hypothyroidism a little bit more comprehensively. If you go to your endocrinologist or regular doctor, unfortunately, a lot of them still use the older method of just chasing the TSH. And that might be one of the reasons why either you haven't been diagnosed or been able to be treated appropriately. But again, lots you can do to try to figure that out. Okay. All right, so let's look at some of the questions. Does hypothyroidism cause weight gain? Yes, absolutely. In fact, that perhaps I would say, aside from fatigue, is one of the most frustrating symptoms that people with hypothyroidism have. Because remember, the thyroid controls the metabolism of every cell in our body. So it's turning on the motor of every cell in our body. So it's a major metabolic hormone. And so it's also turning on, the motor of our metabolism. So if you have low thyroid, you don't have a normal metabolism. And therefore, what does that mean? You can't burn fat to create energy out of it. That's what metabolism means. We burn fat to create energy. So again, low metabolism, we can't burn fat, we can't create energy out of it. And the result of that is weight gain. All right, next question. I'm not sure if I have adrenal issues or hypothyroidism or both. How does one know? Very good question. So, again, the symptoms of them can be very, very similar. You'll find all kinds of questionnaires online. In fact, there's one on our website, Rose Wellness. And just go and fill out a questionnaire and see, look at the questionnaire first. Do I have a lot of symptoms of adrenal insufficiency? Do I have a lot of symptoms of hypothyroid? If you have a lot of symptoms of both, then you may need testing for both. Okay. Which again includes the comprehensive thyroid testing. And for adrenal testing, typically we do either saliva testing, which is the gold standard, or urine testing, known as the Dutch test, where you can actually measure your cortisol levels throughout the day and take a look at your adrenal function. Okay. And so either of these tests can help you understand or diagnose whether you have one or both. In the general scheme of things, most of the research, has said that you should always treat adrenal insufficiency before you treat the thyroid, unless, of course, you're severely hypothyroid. Because a lot of times when you correct the adrenal hormones and cortisol, you can correct and fix a lot of the uh, hypothyroidism as well. Very good question. Okay. Any other questions here? All right. Well, if you do have any more questions, please feel free to contact our office. Again, the contact information is on the slide here. Please feel free to reach our office for any questions. You will be getting a recording of this webinar. Thank you so much. You've been an absolutely wonderful audience. I wish you good health always. Take care. Bye-bye.